Philippines has now surpassed Indonesia as the country with the highest number of COVID-19 cases in South Asia. The Philippines reported more than 3,300 new coronavirus cases, bringing total infections to over 122,000. Hospitals have been overwhelmed with patients and overworked medical workers, urging the government to do more. Overburdened and understaffed, the healthcare system is on the brink of collapse for medical workers in the Philippines. Doctors and nurses have been working around the clock since COVID-19 pandemics struck early this year, and they're crying out for help. Doctor at Manpier Mine has been working 7 days a week for months now, juggling back a week for months now. The past few weeks have been arriving in droves, and most of them are in a bad state.
Most of these patients are connected to a ventilator, connected to a cardiac monitor, which we don't have anymore, and they keep on coming.
Both public and private hospitals in Manila are now at full of capacity, and many healthcare workers lament shortages in personal protective equipment. Medical groups have been sounding the alarm. The healthcare system is overwhelmed and in need of urgent help. They say they're asking for measures such as increased testing and a wider contact tracing.
Our burnout, with seemingly endless number of patients trooping to our hospitals for emergency care and admission. We're waging a losing battle against COVID-19.
The President says the government has heard their place and it's doing all it can to curb the spread of the virus. But he also lashed out doctors and nurses for airing their grievances, accusing them of agitating for revolution.
We are not incompetent here because we are not doctors.
COVID-19 cases have been on the rise since restrictions around the country were relaxed in June. The Philippines now has more than 100,000 confirmed cases and over 2,000 deaths. The government has reimposed strict lockdown measures in Manila and some nearby provinces, forcing public transportation and most business to shut down. Curfews are back, as our checkpoints requiring travel passes for commuters early cases reached records high this week, up to as much as 6,000 in a single day.
We do get exhausted, but we know our work is not done until this pandemic isn't over.
This might have been one of the world's longest structures lockdowns, so Philippines is now Southeast Asia's COVID-19 hotspots. The next few weeks will be crucial in the fight against the virus, and the Department of Health has failed to come up with an updated strategy soon. For now, as the patients continue to pour into hospitals, healthcare workers are gritting their teeth and soldiering on. Carol May Labiano, CNA, Manila.